Hello everyone! Let's talk about vitamin D. What is vitamin D? Vitamin D or calciferol is a fat-soluble vitamin. It can exist in two isoforms, which is vitamin D2, ergo calciferol, and vitamin D3, cholecalciferol. Vitamin D2 is mostly human-made and added to foods. Vitamin D3 is synthesized in the skin from 7-dehydrocholesterol. The vitamin D3 synthesis can be activated with the exposure of bare skin to sunlight. Vitamin D3 can also be obtained from the diet via the intake of animal-based food. Both vitamin D2 and D3 are synthesized commercially and found in fortified foods and dietary supplements. Next, dietary vitamin D can be obtained from four sources, namely natural food, fortified food, beverages, and supplements. There are a few naturally occurring food sources of vitamin D, which includes fatty fish, which is salmon, tuna, sardine, herring, and mackerel, cod liver oil, and egg yolk. Other possible sources of vitamin D are from fortified foods, which are made available on a voluntary basis by manufacturers. Commercially, vitamin D is fortified in cereals, bread, butter, and yogurt. Beverages such as milk and soy milk are also fortified with vitamin D. Vitamin D can be obtained from supplements. Traditionally, many marketed dietary supplements contain 400 IU, which is equal to 10 mg per daily dose. Direct sunlight exposure to the skin is also a good source to achieve optimum level of vitamin D. Based on RNI 2017, a normal person is recommended to take vitamin D about 15 mg per day, while an active person can take up to 2,000 to 6,000 IU per day, which is equal to 50 to 150 mg per day. Mechanisms of action of vitamin D and its crucial role in our overall health. Let's start with the endocrine mechanism of vitamin D. Vitamin D increases intestinal calcium absorption. It also enhances osteoclastic activity, which is vital for maintaining bone health. In fact, vitamin D is essential for bone growth, density, and remodeling. When vitamin D levels drop below normal, our body increases bone resorption to meet calcium demands, potentially leading to injuries like stress fractures, especially common in athletes. Moving on to the autocrine mechanism, which is equally important. This pathway hosts key metabolic processes, including signaling, gene expression, and genetic response. It plays a crucial role in hormone protein synthesis, immune and inflammatory response, as well as turnover and cell synthesis. Without sufficient vitamin D, our body's ability to respond to physiological and pathological symptoms is compromised. In fact, vitamin D acts as a genetic modulator, influencing up to 2,000 genes involved in cell growth, immune function, and protein synthesis. Now, let's explore how the autocrine pathway seems to impact skeletal muscle function. Targets for the vitamin D receptor, VDR, have been identified in various body tissues. VDR regulates gene expression in functions essential for our overall health. This highlights the vital role of vitamin D in muscle tissue. Maintaining an adequate blood concentration of vitamin D is necessary to optimize our genomics and ensure our muscles function at their best. So, what's the overall impact of vitamin D? It acts as a genetic modulator affecting multiple physiological functions, including bone health, muscle function, inflammation, and immunity. All of these functions are crucial for our health, training, and performance. Are you aware of the vital role that vitamin D plays in numerous physiological functions? Now let's look into it. Vitamin D is crucial for bone development, maintaining calcium and phosphorus balance, and recent research highlights its contributions to cancer prevention, reducing diabetes risk, enhancing the immune system, preventing cardiovascular disease and osteoporosis, and even improving athletes' performance. Let's look further about it. Vitamin D enhances calcium absorption and bone mineralization, vital for maintaining strong and healthy bones. An adequate amount of vitamin D and calcium is required for the development, growth, and integrity of bones. Vitamin D has been shown improve bone health by activating genes for improved calcium absorption and renal reabsorption and bone turnover, and aids in osteoclastogenesis. Therefore, athletes with adequate vitamin D levels are less prone to stress fractures and bone injuries. Let's move on to muscle function and strength in the athletes. Are you curious how vitamin D plays a role in it? Vitamin D, found in muscle tissue, is crucial for muscle contraction, strength, and function due to its presence in vitamin D receptors. Athletes with optimal vitamin D level may experience enhanced performance and reduced risk of muscle-related injuries. At muscle cell level, vitamin D is thought to be a modulator of skeletal muscle physiology through both genomic and non-genomic events. Genomic events influence muscle cell proliferation, differentiation, growth, and regeneration, while non-genomic events respond directly impact muscle contraction, resulting in increased force, strength, and contraction rate. Next, vitamin D may positively impact muscle repair and remodeling, contributing to faster recovery after intense exercise or muscle damage. Recent research on animal trials and basic biology studies indicate a positive correlation between vitamin D and skeletal muscle repair and remodeling, highlighting its capacity to influence skeletal muscle remodeling, holding a significance for athletes. Thus, adequate vitamin D levels are associated with improved muscle function, faster recovery, and potentially enhanced muscle growth, making it a crucial factor for athletes aiming to optimize their performance and overall muscle health. Lastly, vitamin D is a vital nutrient that regulates inflammation and innate immunity, playing a crucial role in the immune system's regulation. In athletes, it is well known that prolonged intense training has a suppressive effect on innate immune function and increased risk of upper respiratory tract infection. So, athletes with sufficient vitamin D levels may have a reduced risk of illness and potentially influence susceptibility to such infections. Move to the practical advice to athletes. Sun exposure, in which spans 5 to 30 minutes in the sun during the morning or late afternoon, ensuring face, arms, and legs are exposed. Dietary source as recommended to include vitamin D-rich foods in the diet, as well as consider vitamin D supplements. It also recommended regular monitoring as an additional safeguard where regularly check vitamin D levels through blood tests. This is all the references that we use in the video. That's all from us. Thank you for watching.